Hi everyone, I'm Clara Stenik,
I'm Kayla Rossetti.
And I'm Lindsay Rainier.
and for our project, we decided to research the difference in casualties resulting from acute myocardial infarction, which in simple terms is a heart attack between men and women. So today we're going to discuss the pathology of the disease, the details behind the disparity. We'll provide a hypothesis as well as potential interventions and investigate our results.
What is acute myocardial infarction? In simple terms, it is the medical term for a heart attack. There are two types of myocardial infarctions: ST elevation myocardial infarctions, which is known as a STEMI, and non-ST elevation myocardial infarctions, which is known as non-STEMI. ST elevation myocardial infarctions, or STEMI, are complete blockages of an artery to the heart. This blockage causes the heart to be deprived of blood flow for extensive periods of time, which will lead to extreme damage of cardiac tissue and heart structure. This type of heart attack needs to be urgently treated to unblock the artery and prevent further damage to the heart. Non-ST elevation myocardial infarction, non-STEMI. A non-ST elevation myocardial infarction is a partial blockage of blood flow to the heart. This decrease in blood supply causes some damage to the heart and cardiac tissue, but not complete. A non-STEMI is less serious than a STEMI heart attack, but is still considered a medical emergency. For if left untreated, it may develop into a complete blockage, which is a STEMI. These are ECGs of the different forms of heart attacks. We will go into ECGs later, but as you can see, they do read completely different.
So what causes this disease? Acute myocardial infarction is usually the result of a previous diagnosis of coronary heart disease. There's something called cholesterol deposits, which are also known as plaques. And when this plaque builds up in the heart arteries, it can be very dangerous and cause chest pain or, in serious situations, a heart attack, as well as a stroke. The buildup of plaque is called atherosclerosis, and overall, it reduces blood flow to the heart and other parts of the body. High risk factors of developing atherosclerosis include high cholesterol and triglyceride levels, high blood pressure, smoking, type 1 diabetes, obesity, physical inactivity, and high saturated fat diet.
When looking at the signs and symptoms between men and women, women tend to develop these things 8 to 10 years later than men. Chest pain is the most common symptom in between both genders, however, women tend to experience it less. Men more likely experience chest pain and diaphoresis, and women more likely experience back, neck, and jaw pain, as well as nausea and shortness of breath. Within 65 years and older and 55 years and younger, women have a higher percentage of presenting with no chest pain. Other symptoms for women include indigestion, chest pain, coughing, shortness of breath, discomfort in the jaw, back, or throat, headaches and nausea, cold sweats, and fatigue. Symptoms for men is more so pain in the left arm or shoulder, chest pain, diaphoresis, indigestion, or shortness of breath. As mentioned before, women more likely present with atypical symptoms such as nausea or back pain.
Regarding treatments of acute myocardial infarction, the goal for people diagnosed with STEMI is to quickly restore blood flow to the acutely blocked coronary artery, which is done using a reperfusion therapy. A reperfusion therapy is a therapy that will restore blood flow to the regions of the brain that are ischemic, but not yet infarcted. There are different strategies of reperfusion therapy, which must be decided within minutes of the patient's arrival to the hospital. This chart shows how a doctor would select a reperfusion strategy in patients with acute STEMI. The initial question being asked is, does the patient have signs of cardiogenic shock? Cardiogenic shock is a clinical condition of inadequate tissue perfusion due to cardiac dysfunction. If the answer to this question is yes, then an immediate percutaneous coronary intervention, or a PCI, will be performed. If not, they will ask a series of questions, all to see when a PCI will be performed. A PCI is a minimally invasive, non-surgical procedure performed to improve blood flow in one or more segments of the coronary circulation. So to be more specific, the key factors that will influence the type of reperfusion therapy that will be used are time delays between first medical contact and performance of PCI, time from symptom onset to presentation, presence of cardiogenic shock, diagnostic uncertainty, contraindications to PCI or fibrinolysis, high risk factors that favor no reperfusion. In addition to the reperfusion therapy, the following drugs will routinely be given to patients to slow the progression of coronary artery thrombus formation, minimize the extent of myocardial injury, as well as treat symptoms. Aspirin will thin the blood and prevent blood clots. Nitrates will reduce the symptoms of chest discomfort, as well as treat hypertension. Beta blockers will slow down the heart rate and lower blood pressure. And if you've had a heart attack, these will also decrease the risk of having another one in the future. Anticoagulation and additional antiplatelet agents will slow down clotting, which will reduce fibrin formation and prevent clots from forming and growing. Statins will reduce the amount of cholesterol made by the liver and help the liver remove cholesterol that is already in the blood. And morphine will reduce feelings of pain by interrupting the way nerves signal pain between the brain and body.
How is one diagnosed? When a doctor is diagnosing for a heart attack, a number of tests will be given. TROF-T blood tests will test trophon levels. If one has normal trophon levels for 12 hours after chest pain, that means that they most likely did not have a heart attack. Electrocardiograms, also known as ECGs, can measure the electrical activity of the heart. The ECGs give segments, also known as measurements of the level of trophon in the blood, and can classify the kind of heart attack that person had. Chest x-rays are used if there's uncertainty of other possibilities for the chest pain and can determine if a heart attack caused any complications. Echocardiograms use sound waves to picture the inside of the heart, and it can identify where the heart was affected. Coronary angiographs, they determine if there's a blockage and exactly where that blockage is located. A rise and fall in trophon levels, typical symptoms, ECG changes, and imaging evidence of new loss of viable myocardium or regional wall motion abnormalities would determine a person having a heart attack. A type 1 heart attack would be thrombus, presence of clinical symptoms of ischemia, increase or decrease in the concentration of cardiac trophons, and an increased concentration of cardiac trophons above the upper limit of normal. Type 2 heart attacks would be imbalance of oxygen delivery and demand, presence of clinical symptoms of ischemia, increase and or decrease in the concentration of cardiac trophons, as well as increased concentration of cardiac trophons above the upper limit of normal. Just acute heart failure would be acute myocardial injuries, absence of clinical symptoms of ischemia, and increase or decrease in the concentration of cardiac trophons. And one that is having kidney failure and structural pathology of the heart being affected, but not a heart attack, would have chronic myocardial injury and constantly high concentrations of cardiac trophons. The disparity is the symptoms of presentation time for women is 280 minutes, while for men it's only 249 minutes. 42% of women will die within 1 year, while only 24% of men will die. Over 15,000 US women will die from heart disease each year, and 84% of women, while only 78.4% of men reported at least one non-chest pain symptom. As you can see from the image, in all age groups, women have a higher percentage of death rates. This is a disparity because more women have been dying from cardiovascular disease than men since 1984. Women tend to be older, which leads to the fear of complications. An example of this is women tend to bleed more due to increased rate of red blood cell transfusion. Women are also at a higher risk for in-hospital complications and death by 15, 20 to 20% more than men. The time to run tests such as ECG were also longer for women. Women were also less likely to be cared for by a cardiologist. Women were less likely to receive invasive diagnostic and therapeutic interventions, and when they did receive these invasive diagnostic and therapeutic interventions, they tended to wait longer to receive them. Revascularization procedures were performed less in women, and women often had atypical symptoms, which made them think that they were not having a heart attack. Women are less likely to receive acute heparin, aspirin, and statins when discharged, and women are at a higher risk for unadjusted in-hospital death.
Hypothesis as to why this disparity exists. Due to acute myocardial infarction being traditionally seen as a disease for men and only men, and the discrepancies in presentation of symptoms for women, many women do not realize they are experiencing an acute myocardial infarction, and they do not seek help, leading to inflated rates of death when compared to men due to delayed treatment time. Potential future therapies. Unlike men who are recommended to go to a cardiologist between the ages of 40 and 45, most women do not see a cardiologist until they have already had, or are experiencing severe symptoms of heart disease. This is increasingly concerning when the mortality rate of women who experience acute myocardial infarction is taken into consideration. To rectify this, a simple solution would be for women to be encouraged to see a cardiologist by the time they reach middle adulthood. Early diagnosis and evaluation of risk is the key in surviving or preventing a heart attack. So women seeking medical help before an issue arises would drastically reduce mortality rates. A healthy lifestyle can also reduce risk of acute myocardial infarctions by up to 80% in women. Acting on this, women can be urged to pursue an active lifestyle with a balanced diet by their cardiologist, which will in turn reduce their risks of experiencing a heart attack and increase their chances of survival and minimal damage if they were to have one. Interventions. In order to rectify the disparity, we will need to reach out to women of all ages to educate them of their risks of suffering acute myocardial infarction, despite their age. To do this, we will use TV shows that have a demographic of mostly women. The shows we will use will be shows like Grey's Anatomy, Gilmore Girls, New Girl, and soap operas like General Hospital. We would enlist the help from the production companies associated with these shows and have them show our public service announcement in between some scenes before a commercial break. The public service announcement itself will be short, and it will inform viewers that women can suffer from acute myocardial infarctions or heart attacks, and they may be at risk despite their youth. The PSA will list symptoms more common to women, such as nausea, jaw and neck pain, and headaches, and urge viewers to call emergency services if they are experiencing any of these symptoms, or they may be experiencing a heart attack, despite the non-traditional presentation of symptoms. Investigating the results of our intervention. We will look at statistics nationally to see how many women come into the ER over a 10-year period presenting with atypical symptoms. If these numbers go up, we will know that the public service announcement is reaching and educating the target audience. To measure if this is making a difference in the mortality rate of women, we will have hospitals monitor and report how many women and how many men die from acute myocardial infarctions within their ERs. We will continuously monitor these statistics to see if mortality rate is decreasing due to increased in early diagnosis for women. Okay, and these are our references. Thank you guys so much for listening to our presentation on acute myocardial infarctions for women versus men. We hope you learned something, and just remember that you can have a heart attack as a woman and it will present differently. Thank you. Have a great day.